On HIV treatment.
I am on HIV treatment.
I am on HIV treatment.
I am a success story.
I'm a success story.
Everyone, everywhere
should have access
to treatment.
Be a success story.
Be like me.
Like me. Like me.
Just like me.
The 15 million success stories are that the world has exceeded the MDG number 6 target of combating HIV and AIDS and is well on track to end the AIDS epidemic by 2030 as part of the SDG or Sustainable Development Goals. Now, the United Nations or Joint United Nations Program on HIV and AIDS or UNAIDS leads and inspires the world to achieve its shared vision of zero new infections, zero discrimination and zero AIDS-related deaths by 2030. Now, great strides have been made in reducing infection rates of HIV around the world. Now, the job is to make certain that these 15 million success stories are sustained and will continue to implement effective prevention and treatment programs in areas of need. So today we'll learn more about these HIV and AIDS success stories, how the world has responded to this pandemic, and how this AIDS pandemic can be ended by 2030 in South Africa and the rest of the world. Our panel includes experts from the National Department of Health in South Africa, the UNAIDS, PEPFAR, and the Treatment Action Campaign. So sit back, relax, and learn from this exciting show ahead. You can be part of this show by calling us with your questions or views at Johannesburg 714-6843, 6847, or 6857, or interact with us on our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk. I'm Dr. Sello Mutaung, and this is Health Talk.
Peace must be sought above all because it is a condition for every member of the human family to live a life of dignity and security.
It wasn't about the pills. It wasn't about the antiretroviral pills. It was about getting donors to commit to chronic care for a chronic condition. That was the real revolution.
And to meet a severe and urgent crisis abroad tonight, I propose the emergency plan for AIDS relief.
6,500 Africans dying every single day from AIDS, a preventable, treatable disease. For lack of drugs we can get in any pharmacy. That's not a cause. That's an emergency.
It is difficult to imagine how the world can grow together and overcome the instabilities and inequalities of global interdependence unless something serious is done to turn the tide on AIDS.
We live in a world where the AIDS pandemic threatens the very fabric of our lives.
On Monday, my administration will publish a final rule that eliminates the travel ban, effective just after the new year.
It is a challenge with profound social, cultural, and economic consequences.
China lifts a ban on people living with HIV, AIDS, and other sexually transmitted diseases from entering the country.
The face of AIDS has changed dramatically since the 80s. Where is the protection of my gender's human rights?
Let us rise and fight for an HIV-free generation.
United Nations Secretary General Ban Ki-moon launched the book in Rome, The
The book was produced by UNAIDS and the UN World Tourism Organization's STEP Foundation.
The AIDS response has been critical to development because when this epidemic was raging, when prevalence, particularly in southern Africa, was so high, life expectancy was plummeting.
HIV relies on this enzyme to make new copies of itself, so Truvada prevents the HIV virus from multiplying and establishing infection in the body.
In the name of great Africa, we shall fight and conquer AIDS.
Right, so tracking the AIDS response over a 15-year period from 2000 to 2014, 15 million of the 37 million people living with HIV are on treatment today. And according to the recently released UNAIDS report, the goal of getting 15 million people, on life-saving HIV treatment by 2015 has been met 9 months ahead of schedule. Now, to tell us more about this UNAIDS report, we welcome on studio Dr. Alistair Reid, who's Special Strategic Interventions Advisor for the UNAIDS. Dr. Reid, welcome to Health Talk.
Thank you. Good morning.
All right, and with him, of course, is our very own Dr. Yogan Pillay, who's Deputy Director General in the National Department of Health in South Africa. Welcome to Health Talk, Dr.
Good morning, Dr. Tung.
All right. Now, let's start with you then, Dr. Reid. This UNAIDS report, I mean, it's a groundbreaking report, and it's really success stories, isn't it? Tell us more about it in terms of, when it was released.
Yeah. Well, yes, it is a very exciting report. It's the first time that the global health community has met a global health target on time, right. In fact, ahead of time. Yeah. It was launched just last month, right. And it was launched at one of the meetings of African finance ministers, right. Showing the importance of funding and sustaining the AIDS response. Right. If you think back in 2001, when just after the Millennium Development Goals were launched, there was only 1 million people in the world on treatment. Yeah. And in 15 years, we've reached 15 million on treatment. So,
well, talk about 2001. I mean, it appears that the year 2000 was really the turning point in HIV and AIDS, isn't that so?
It certainly was, and particularly for the rest of the world. Right. Until then, antiretroviral treatment for HIV was only available in the wealthy Western countries. Mm-hmm. And in fact, it was the Durban AIDS conference in 2000, Turning the Tide, where the global community said, this is not right, and we need to get access to treatment for everyone, including people in Africa. And there was a global movement to get the prices reduced, to get the health system strengthened so that antiretroviral treatment could be delivered everywhere. And we've come such a long way since that watershed conference.
What was the trigger? I mean, was there any special trigger around that time? I mean, that really
I think it was a sea change. Yeah. It was, the Durban AIDS conference was where Nkosi Johnson really made this stunning plea for change. And I think people realized that it was unfair. It was an equity issue. And it was the work of Treatment Action Campaign and other civil society movements that really demanded change. When people were saying, oh, we can't do antiretroviral treatment in Africa because people can't tell the time. And that was, realized that was just unacceptable. And so I think we had the political commitment, we had resources coming, the increasing resources for AIDS in Africa. And this is what the report that we launched is telling us. Okay, AIDS was a disaster for the world, but it actually changed everything for the good. Right. And there's sort of 15 lessons that we pull out about what AIDS did differently.
Let's get into those, success stories, as it were, and perhaps start with the new infections, because I believe we've reduced that quite substantially, isn't that so? Tell us about it.
We've reduced new infections by around 40% since I think it was 2004, and That is critical, and in fact that is where we're not doing well enough. That's the one weak point of the AIDS response, is that we aren't focusing enough on prevention. Right. But in terms of treatment, we are doing extremely well, and that's the 15 million by 2015. Okay. Now, the great thing about treatment is it also has a prevention effect. So it can reduce, if somebody's on appropriate treatment, their chances of transmitting the virus to an HIV negative partner are reduced by about 97%.
And the fact that the fact that a whole lot of people are on treatment, it means people are living longer, isn't it?
Absolutely.
Perhaps, Dr. Pillay, I can pull you into this one. The effect we've seen in terms of the life expectancy in South Africa. Your comment on that?
No, it's been spectacular, Dr. Mokhtar. Yeah. And it's largely attributable to the antiretroviral program. Mm-hmm. And as you know, of the 15 million in the world, 3 million are in South Africa. So 20% of the people who are on antiretrovirals in the world are in South Africa. Mm-hmm. Now that's right, because we have such a large prevalence of HIV in this country. Right. So because we have so many on treatment, the life expectancy has gone up from something like 57 years in 2009 to 62.1 in 2013-14.
A remarkable achievement.
It's remarkable. Nowhere in the world would you have seen such a big jump in life expectancy over such a short period of time.
Right. Dr. Reed, let's get back to the report then. In terms of, all right, we've seen about the impact on the new infections. What about the mother-to-child transmission rates? Have we had any successes there?
That's another really good success story, and particularly in South Africa. South Africa has the highest reduction in new infections amongst children, an 87% reduction due to implementation of the global plan to eliminate mother-to-child transmission. The transmission rates were around 8% back in 2008, and now we're less than 2%. So that is below the global target for elimination, and South Africa is on track to eliminate mother-to-child transmission, which is very, very exciting news.
Right. And lastly, around the AIDS-related deaths.
Yes, as Yogan said, the scale-up of HIV treatment means that we have greatly reduced HIV-related deaths. I think it was 330,000 deaths down to 120,000 over the last few years. Mm-hmm. So almost cut it in a third, and that's primarily due to the scale-up of access to treatment.
Mm-hmm. Dr. Pillay, I mean, clearly, this feels like we should be celebrating. But let's just kind of have a look at the current scenario in South Africa now. Where are we in terms of, incidence and prevalence of HIV and AIDS?
So with respect to prevalence, and prevalence, remember, is both new cases and old cases, right? So people living with HIV.
Correct.
And at the moment, we have about 17% of South Africans living with HIV. That translates to 6.4 million South Africans living with HIV. Mm-hmm. So that's a large number. Mm-hmm. Now, the good thing about that is people are living longer, so that number should be growing. Mm-hmm. The problem, though, is that we still have a large number of new infections, as Alistair says. Right. And we would like to have reduced new infections and cut it by half between 2012 and 2016. That's the plan, and still is the plan. Yeah. But as Alistair says, we are not doing as well as we would like to be. We're doing very well in cutting transmission from mother to child transmission and up to about 15 years of age. Mm-hmm. So there we're doing rather well. Yeah. The challenge is young people, especially young girls, 15 to 24.
Well, talk about young girls. I mean, this is Women's Month. I mean, in terms of the vulnerable populations in our society, can you just comment on that quickly in 30 seconds?
So we have a number of vulnerable groups. Yeah. We know young girls and young women are vulnerable. The transmission rates are high there. We also know that people living in informal settlements are vulnerable. Sex workers are very vulnerable, and men who have sex with men in our context. Okay. Then injecting drug users will be another group, but a bit smaller. Okay. But those will be the groups.
Just hold it there because we're going to get back. We just need to go for a quick commercial break. Please stay with us because after the break, we get to understand how the world has responded to this pandemic.
Welcome to AM News here on SABC News Channel 404.
So the people who also should be concerned are the people who voted for people of that ilk.
South Africa is indeed a unique country, and South Africa has a democracy that is very exceptional.
If people want to change the rules, do it properly, do it within the context of the Rules Committee within Parliament, and when you shout, it doesn't mean people are listening to you.
But there is a point of authority that must always prevail.
The ANC is very determined. We will not allow South Africa's Parliament to be dragged down into the mud, and we will defend the Constitution and Parliament.
I think our country is really being torn to pieces. And I think that the struggle for liberation didn't take place for people to play the fool like this in our country.
That's AM News, daily at 10 a.m. on SABC News.
PEPFAR, saving lives, investing in people. PEPFAR, partnering for an AIDS-free generation.
10 years ago, AIDS was a death sentence, stalling economic development, targeting youth in their prime, threatening the security of millions.
We were in the midst of the period of denialism in South Africa. We were working very hard against an administration that was pushing back. And then Durban 2000 highlighted this difference between the North having antivirals and the South dying of AIDS.
Most distressing was the fact that by that time, there were some drugs appearing in the developed world. AZT was the first, and then there was a sequence of drugs. So we knew that there were drugs available which could treat these infected children. And we just had no access to them.
In 2003, the United States launched the President's Emergency Plan for AIDS Relief, PEPFAR. The story of PEPFAR in South Africa begins as an emergency response to a devastating epidemic that was sweeping through the country.
Many people would agree that George Bush was really very visionary. Unlike anything that probably had ever been done before in terms of international global health contributions, PEPFAR was this. PEPFAR saved hundreds of thousands of lives.
This comprehensive plan will prevent 7 million new AIDS infections, treat at least 2 million people with life-extending drugs, and provide humane care for millions of people suffering from AIDS and for children orphaned by AIDS.
PEPFAR was given the head start it needed to provide support and expand existing platforms and programs.
Kudos to the American people. They stepped in when we had people dying in queues. They helped us save literally millions of South Africans.
The difference is visible every day on the streets of South Africa. Hundreds of thousands of people have had their health restored, like my health. After 17 years, I live a full and vigorous and active life. Because of antiretroviral treatment. My treatment is paid for by my medical insurance. But for many millions of other people, it's PEPFAR money that has made that difference.
PEPFAR has invested $4.2 billion over the past decade in prevention, treatment, and care for those with HIV AIDS, and to increasingly strengthen the country's health system. PEPFAR represents the largest foreign assistance initiative by any nation in history to combat a single disease. U.S. investment increased to over $500 million between 2008 and 2011. As the South African government increasingly funds and manages the HIV response, PEPFAR funding is planned to gradually decrease. Working towards the goal of an AIDS-free generation has led to the following achievements. More than 2.4 million HIV-positive individuals on ARVs. Reduction of mother-to-child transmission down to less than 3%. More than 38 million individuals received HIV counseling and testing. Over 624,000 men circumcised as part of prevention. More than 477,000 orphans and vulnerable children receiving care services. PEPFAR's early response to the crisis in South Africa was the catalyst that sparked the rollout of hundreds of projects and programs throughout the country with strategic partners. What started out as a critical intervention steeped in compassionate action today leaves a legacy of cooperation, collaboration, and sustainability. The impact of PEPFAR is a lasting legacy that leaves a strengthened health system and broadening access to health care, with HIV AIDS a manageable chronic disease.
It was an extraordinary initiative, and it suddenly made possible what people had thought was impossible to do.
The United States of America will remain the global leader in the fight against HIV and AIDS. We will stand with you every step of this journey until we reach the day that we know is possible, when all men and women can protect themselves from infection, a day when all people with HIV have access to the treatments that extend their lives, the day when there are no babies being born with HIV or AIDS, and when we achieve at long last what was once hard to imagine, and that's an AIDS-free generation.
I don't think we'll have arrived here where we are without PEPFAR. At the moment, we are tipping the scales. We are not claiming by any means that the HIV pandemic is over in South Africa. We still have a long period to fight, but we have turned the corner.
PEPFAR.
All right, so PEPFAR's partnership with the South African government has achieved tremendous successes, and as our health minister says, there is indeed still a long way to go in eradicating HIV/AIDS in South Africa. But before we start talking about how this pandemic can be ended, let us now try and examine just where we come from in South Africa in as far as HIV/AIDS is concerned. And we welcome Steve Smith from PEPFAR. We've heard a lot about PEPFAR. Now, Steve Smith is Health Attaché, U.S. Mission to South Africa. Welcome to Health Talk,
good morning.
Steve. And of course, we still have Dr. Jorgen Pile, Deputy Director General in the Department of Health. And we also welcome another special guest, Ms. Bongile Chabalala, who is the Provincial Chairperson of the Treatment Action Campaign in Gauteng. Welcome to Health Talks.
Thank you very much.
All right. Perhaps let's start with you, Dr. Pile, and kind of, reflect on HIV/AIDS in South Africa. And I mean, we shared about the successes, in the previous segment. Let's just examine where we come from. Perhaps we can take it back right up to the late 90s, insofar as HIV/AIDS is concerned.
So I think, as the inserts showed, we were somewhat latecomers to trying to end the AIDS epidemic in South Africa. And we started with prevention, as I think many people know. And we were pushing the prevention envelope. But when the drugs became available, we were slow to start to implement an antiretroviral program in the country. And I think the Treatment Action Campaign, as well as academics in the country, were at that time, and we're talking now the early 2000s, in the forefront of pushing the envelope. But I must also say that since 2004, the government has been providing antiretrovirals, but the scale-up happened with President Zuma's government in 2009. And I think the political leadership that we saw from 2009 from the president and our health minister, Dr. Aaron Matsuledi, has been very significant in helping us reach the 3 million people on HIV right now.
Steve, our health minister just now was saying, without the help of PEPFAR, we could not have achieved some of the successes that we've achieved. What inspired you to want to help out South Africa?
Sure.
Or you, obviously the United States and the President's Emergency Fund, yeah?
At the beginning of PEPFAR, it was an emergency.
Yeah.
And we saw the opportunity to take treatment that was available in the United States and Europe, but not available in Africa, and really make that possible in places like South Africa to save lives. But it's evolved substantially since then. At the time, we were really trying desperately to save every life. Now we're trying to reach a whole system, strengthen the system, and do it very much in partnership with our South African government colleagues. And the South African government colleagues lead the way. We play a supportive role in that partnership. And as we're talking about the transition of the government ownership and leadership, we now see a very innovative government that is evidence-based, that is treating 3 million people. It's the largest treatment program in the world. It is a phenomenal success.
Okay.
When we started this program, this is what we wanted to see happen.
Okay.
And so that success is a testament to every life that's saved. We're looking forward to continuing that partnership until we reach that AIDS-free generation.
Great stuff. Now, Dr. Pillay, obviously funding is, foreign donor funding is important, but our own government has been funding HIV/AIDS programs. Your comment?
Absolutely, but let me first also join Steve in thanking the US government and the people of the US for their contribution, because as the Minister said, it's been a significant contribution for the last almost 11 years now.
Right.
But the South African government, and I must say, especially the President Zuma's government, has really increased the amount of funding for HIV dramatically in this country. So the South African taxpayer funds the bulk of our interventions, whether it's on prevention or treatment, or care and support, which we also need to provide.
Yeah.
And I think we certainly from the Department of Health are very grateful that the South African government and the leadership under President Zuma has seen it as a very important intervention to save lives and to ensure that people live as healthily and as long as possible.
Okay. Sibongile, let me invite you in here. I mean, the TAC was quite instrumental in applying pressure and, making, the right kind of noises, if I can call it that, How do you see where we are now in terms of, the successes of HIV/AIDS in South Africa and whether or not we still have some challenges ahead?
Yes, we have succeeded tremendously in South Africa, and as Treatment Action Campaign, we are very happy about that. However, we still see challenges of people who are dying with HIV. And recently, the statistics of HRSC that shows that young children between 15 and 24 are still getting infected by HIV. That is worrying because we want an AIDS-free generation. So if less than 1,000 of young people are infected by HIV every day, that means we are still far ahead from winning HIV in South Africa.
Okay, so the vulnerable populations, the ones most at risk, as far as you're concerned, are the young people between the ages of 15 and 24.
Yes.
Okay.
And our worry is that yes, we acknowledge the government by drafting the policy of bringing condoms in school, because we know that our young generation are given all these rights, of which is right we upload them. They have right to TOP at the age of 12 years without the consent of a parent. They have a right to insert genital implant, of which it will prevent teenage pregnancy. However, they don't have rights to condoms, especially in schools, because when we conduct dialogues with young kids in school, you'll find that these young people, they need condoms. Although as parents and other departments, we don't see a need for condoms.
Right,
but
just
the teenage
hold it
pregnancy
there, because we need to go for a break. We will come back to these issues of prevention and use of condoms and so on, but just after the break. Okay, we find out after the break how this AIDS pandemic can be ended by 2030. Please stay with us.
An investigation is now underway to establish whether the men were involved in other crimes. One of the men has also been linked to another shooting 2 weeks ago where a police officer died.
This is the strongest reading since October last year. New orders led to a rise in output for the first time since November. This means that the first quarter could have ended with a new high momentum that's likely to get carried into the second quarter.
An increase in oil supply from that country is likely to increase global oversupply of oil, and that in turn should spell continued lower oil prices.
We saw that really with the adjustments in the fuel price, both in March and now in April, that consumer inflation is bottomed and it will start to rise slowly going forward over coming months.
For all your business news, stay tuned to your favorite channel, SABC News, at 1 Monday to Friday.
In 2003, Abiyat Godana found out that she was pregnant. She had been living with HIV since 1997. To help ensure her child would be born free from HIV, she enrolled on a program for the prevention of mother-to-child transmission of HIV. Her son Mikias was born free from HIV and was followed a few years later by a daughter.
I went to the hospital because I wanted to have children free from HIV. I followed up with my treatment to assure myself and to be a role model for others. I'm very happy that my children are free from the virus. They are my testimony, and I even consider myself free when I look at them. The thought of having a family free from HIV brings so much joy to my life.
73% of all pregnant women living with HIV across the globe have access to PMTCT services. Abiyat is among the 15 million people receiving treatment today, up from fewer than 700,000 in 2000. One of the most important treatment goals in history has been met.
We have proved beyond doubt that treatment can be scaled up, no matter what the setting. Rich or poor, the right to health belongs to all.
There are 58% fewer new HIV infections among children than there were 15 years ago. Near Johannesburg, Koketso Moketawa, who was born with HIV, also didn't think she could start a family.
When I found out that I was pregnant, I made sure that I continue with my treatment. I made sure that now there's no time of defaulting and leaving my medication. And I attended a clinic, which is in Coronation Hospital, which is the clinic where we have PMTCT.
The 24-year-old had an HIV-free baby girl who loves cycling around the neighborhood. Falling antiretroviral medicine prices have made it possible for more people to access treatment.
It was almost $15,000 per year per person. Today we're talking about $80, $100 in some cases. So we managed to also demonstrate that they were wrong.
HIV treatment not only saves lives, it also prevents new infections. Achieving universal access to treatment is critical to ending the AIDS epidemic.
Welcome back. So the world is embarking on a fast-track strategy to end the AIDS epidemic by 2030. Now, to reach this visionary goal after 3 decades of the most serious epidemic in living memory, countries will need to use the most powerful tools available, hold each other accountable for results, and make sure that no one is left behind. To explore this a little further, we welcome back Dr. Alistair Reid from UNAIDS, and we still have Steve Smith from PEPFAR, and of course, Dr. Jürgen Pillay from the National Department of Health in South Africa. Gentlemen, let's talk about this ideal, this vision of ending AIDS by 2030. First of all, perhaps let's start from a funding perspective. And we'll start with you, Steve. Which are the, and we're talking about this in a global sense, but is there a priority sort of area in the world, as it were?
The priority area is we want to go where the virus is. We want to have our interventions have the highest impact on the highest incidence of HIV. So the priority here in South Africa is to look at the highest burden areas, to use the UNAIDS 90-90-90 targets, which is to increase the number of people tested, so 90% of the people with HIV know that they have HIV. Then to increase the number of people who get treatment, so 90% of them get treatment. And then to increase the quality of that treatment, so 90% of them are virally suppressed, so that's adherence. So we need to look at the interventions that we know work. We have evidence that shows what works. We're working to focus the programs for greater impact. And we're doing that in partnership with the South African government, with Global Fund, with UNAIDS, with all of the major stakeholders to try to have the highest impact on the best evidence-based programs.
Just tracking, I mean, he mentioned the first area in terms of, testing, just to make sure that a whole lot of people get tested. How have we, or in a global sense now, how have we done in that aspect? I mean, have we seen a spike in the number of people that have tested for HIV before? Do we think that we have a lot more people that know their status?
Yes, we're certainly a lot more people today know their status than at any other time in history. But we know that the
the hardest to reach populations we are still failing. So for reasons of stigma and discrimination, people like sex workers, men who have sex with men, adolescent girls and young women, we've heard, find it very difficult to access health services, which are very matriarchal, and it could be their auntie who's the nurse in the facility. So it's very difficult for them to go in and talk about sexuality and get tested for HIV. So, you know, we need to take this out of the health service. We need to try and make HIV testing much more accessible. There needs to be a shared responsibility. Communities need to be supportive to encourage HIV testing. That's where the people like the South African National AIDS Council, they're building, you know, Jürgen Piele's here representing health, but HIV goes much beyond health. So we have to bring in the traditional sector, we need to bring in the religious sector, businesses, private sector, and as we heard from Sibongile, the important role of communities and those most affected by HIV, so that we can really penetrate the places that we're not reaching right now.
Yeah. Talk about funding. I mean, are we really looking at the amount of funding? Because there's talk that the amount will taper down over time, meaning that, you know, the recipient governments, as it were, will also increase the amount, you know, that they allocate to you know, the fight against HIV and AIDS. So is the focus on making sure that the amount tapers, or is it making sure that the program actually runs successfully? Steve?
The program's on making sure, the focus is on making sure it runs successfully. We have a shorthand. We call it doing the right things in the right place at the right time. And the right time is right now to focus on reducing new HIV infections.
Yeah.
So we have an agreement with the South African government that sets forth an anticipated reduction in PEPFAR resources and a very substantial increase in South African government resources. The South African government owns and is responsible for this program, and we're here to help.
All right. Maybe let me get a comment from you, Dr. Piele, in terms of the future now. I know we're going to talk about it in the next segment, but in terms of funding in respect to, you know, donor funds, as it were.
So because we know, Dr. Matong, that we need to scale up to end AIDS by 2030, we did what's called an investment case for HIV and for TB, because we have significant co-infection rates in South Africa. To try and figure out two things. One is, what are the best buys? Where should we invest our money? And what do we know about what works and what works best? And then to cost that. So we've just completed that exercise to look at what will it take to decrease incidence, new cases, and mortality from AIDS and from TB, and how much will it cost up to 2035. And the good news is that we're investing. The not so good news is that we'll have to increase our investments quite substantially to decrease the incidence and mortality from HIV. Much smaller investments are needed to decrease both new cases and mortality from TB. So we've done that work. So we will now be presenting that to, of course, the leadership in our government to see how we can then bridge the gap between the funding that's required and the funding we have, both from donors and the South African government.
Okay. But the message is, for you guys, obviously South Africa and other countries in need will still look up to you to, you know, lend a hand of support, as it were, going forward. Gentlemen, I'm afraid that's all the time we have for you guys in this segment, and I want to thank you very much for contributing on this show, and of course for all the work that you've done in the region, and continue doing great work. All right, we're going to go for a short break. Now, how can we end AIDS in South Africa? Please stay with us, because we'll find out after the break.
We live in a digital era, and the number of Africans with mobile phones is rapidly increasing.
Twitter use is predominantly being done on smartphones. This is a very African phenomenon.
Here, there are constantly new innovative ways to make the internet more affordable. With that, we're seeing protests against governments proposing methods to limit access. On Network, we give you information about all of this. We also have new computers, games, and robots.
Join Siphumelele Zondi on Network every Sunday at 19:30 CAT.
Welcome back. Now, South Africa has more people living with HIV than anywhere else in the world. Now, providing access to antiretroviral therapy has kept more people alive than would have been imaginable about 15 years ago. Now, the effectiveness, availability, and affordability of potent ARVs make it possible to contemplate ending this epidemic of HIV. Now, let's explore this further with our guests. Dr. Jorgen Pillay, Deputy Director General in the Department of Health in South Africa, and Sibongile Shabalala, Provincial Chairperson in Gauteng of the Treatment Action Campaign. Now, perhaps let's start with you, Dr. Pillay. We're talking about this vision. Of course, there is this vision globally of ending AIDS by 2030. We've certainly set our own targets. Just quickly remind us in terms of what we have, planned going forward.
So in the National Development Plan, we say two things about HIV, at least.
Yeah.
One is that we need to increase life expectancy to at least 70 years by 2030. Now, one of the major contributors to mortality, as we said previously, is HIV and TB. So in order to reach 70, we need to do as much as possible on HIV and TB. The second is that we need to have a generation free of HIV by 2030, which means we need to start now to ensure that no one is infected with HIV, which means prevention. So those are the two critical things.
Yeah.
And the third is, of course, to decrease mortality in pregnant women and children. And as we know, about 50% of maternal mortality and about the same percentage of under 5 mortality is associated with HIV. So we can't reach many of the NDP targets if we don't deal decisively with HIV.
Sibongile, let's talk about the problem of prevention now. I mean, let's call it a problem. I mean, it's a target area. I mean, it's an important target area that we need to look at, How do we make sure that we prevent HIV and AIDS infection amongst young, especially our young people between the ages of 15 and 24?
Yeah, as I've said earlier on, if we provide condoms, we are not saying condoms will eliminate HIV or will prevent, but at least there'll be an access to condoms will eliminate HIV, because the rights that these young people are given are extremely well. Okay, it's fine. We are happy about it, but then they are not preventing. They haven't given a right to prevent themselves on HIV. Now we are pushing, advocating for the policy of condoms in schools, and the Department of Education doesn't want the condoms in schools, of which these children are sleeping at schools, and these children are sleeping with educators. And these children are begging school to go to an older man to sleep with the older man. So if condoms are accessible, and they can't just go to the clinic and find us, as Bongiles went there to take our treatment and all cocos and just take a packet of condoms. They said, we are afraid of doing that. We can't. It's just, it's not our culture to just pick a condom in front of all these older people that are sitting there in the clinic. So if condoms are available, and if treatment is available, as we know that treatment is one of the prevention methods that we are using, then I think we will be able to fight HIV and AIDS, and we will end it by 2030. But besides that, with the children getting infected every day, then I don't see us winning.
Okay. Dr. Pillay, she's mentioned two very important points. Firstly, the condom story. I mean, the one criticism, or at least suggestion, is that you can't just supply condoms without, concurrent education and awareness program. I'd like you to comment on that. And also the other aspect that she's raised is that of stigma.
Yes.
But how do we deal with the problem of stigma going forward?
So let's start with prevention. And the critical thing there is combination prevention, Dr. Matu, right? So we can't just do condoms, we can't just do treatment. We need to do a number of things. And for the longest time, we weren't quite sure how to package these things and target the vulnerable communities. Now, with the US government, we've got a new program that's going to be launched soon. It's called DREAMS, and it's really to target the 15 to 24-year-old girls and young women with a combination of prevention, precisely to do what Sibongile says we should be doing, to ensure that they get maximum protection so that they don't acquire HIV.
Tell us more about the DREAMS project.
So it focuses on trying to figure out what package of interventions need to be delivered to girls and young women and how we should deliver them. So we've picked 5 districts in the country which have high prevalence to try out this package. And once we know it works, we then will scale it up throughout the country because we're quite worried about it. But that's a major prevention strategy that will be announced and launched soon. We are hoping by the Deputy President and the Minister of Health together with the Ambassador Burks from the US.
Does it deal with the stigma issue?
It will deal with the stigma issue as well. As you know, SANAC has recently concluded a stigma survey to try and figure out what the nature of stigma is and how big a problem or challenge it is. And we're finding that some of it is externalized, but the extent of externalized stigma, that is people, for example, refusing to shake hands with somebody who's HIV positive or kiss them or whatever, that's declining. But the internalized stigma is the challenge, that people themselves feel bad about their status. And that's what we need to figure out how to deal with respect to the individuals who feel bad about their status.
What about getting more people to be tested? I mean, there's still a lot of people out there who don't know their status, who still are afraid to go and get tested. STAC, what role are you going to play in trying to get people out to go and test and know their status?
Disclosure and encourage people to go and test. It's our baby. We are doing it every day. And the importance of knowing your status. But the challenge that we have is that we will encourage people to go and test, and people will go and test, and after that, those people are lost to follow up on those people. We want to encourage people to go and test, and then be followed up with the treatment after that, or be followed up with properly psychological support, or because when we are just told that we are HIV positive, you can't just say okay, it's fine. Like when you have diabetic or sugar or other diseases that we normally do. But HIV, it's the way it was described at first. It makes a person to introspect. Why me? Why do I have HIV? Why am I supposed to get HIV? So all of those things, they need to deal with that, because in the process, after the person has tested, we'll lose these people because sometimes they have denial to say it can't be me, it's not me, they've made a mistake, and they'll go all around to try to figure out what happened really, or how can I eliminate this. But if as a South Africa and the civil society organizations can come together and able, as the president did, with the HCT campaign, that was very tremendous, and it led to most of people to go and test. And we continue doing that, but then we need to figure out how do we keep these people in the facility so that they'll be able to follow up on them and the treatment.
Okay. Dr. Pile, just the last 30 seconds, that we have in this show, in terms of treatment now, we've made great strides. I mean, in rollout of ARVs, we've improved the combination to improve compliance and so on. In terms of, going forward in the guidelines now, there are people that are saying, no, hang on, start, as soon as you know that you're HIV, irrespective of CD4 count, start ARVs. Your comment quickly on that.
So we're waiting for the World Health Organization to come out with new guidelines. There are 2 big studies, randomized clinical control studies, that showed exactly that as soon as people are diagnosed, they should be put on treatment because outcomes are better. And it's kind of called test and treat. The other big issue is what's called PrEP. That is those that might be vulnerable to HIV acquisition, take an antiretroviral to prevent acquisition. So those are the 2 new things that the World Health Organization is now considering. And in the new guidelines that will be coming out probably end of December, beginning of January next year, those 2 issues will come out, and then we will have to consider as a country how we react to those guidelines from the WHO.
All right, okay. Gentlemen and lady, it's been an awesome discussion, and I just hope that we'll build on the successes that we've achieved so far and look forward to that day that will say we have an AIDS-free generation. Thank you very much.
Thank you.
All right. It's on that note that we come to the end of our show today, folks. Your views and comments are extremely valuable to us. Please share these with us on our Facebook page by going to SABC Health Talk and like our page. Follow us again on Twitter at SABC Health Talk. You can join us next week, same time on the SABC News. And remember, you can watch repeat shows today at 2 p.m. and 10 p.m. And you can, if you miss any of the previous shows, you can get them on the YouTube link. So from myself, Dr. Salomitaung, and the rest of the crew here of Health Talk, it's a warm goodbye and thank you so much for watching. Please do take care.